Welcome everyone to the Focus series. Hello everyone, my name is Han Song-ha. I'm the Communication Director of MSF Korea. Today we are offering simultaneous interpretation in Korean and English, and there is a Korean and English button where you can select the language of your choice. Last August, there was a last June and until for a few months, there was a large unprecedented flood that hit Pakistan and it left a third of land underwater, and it has affected more than 30 million Pakistani. It has been 6 months since the calamity, since the government has declared a national emergency. Today, we will look at current situation in Pakistan and MSF operation over the past 6 months during today's focus briefing. Today's briefing will be presented by Sergio Cecchini, who is managing and supervising MSF operation in Pakistan, and we will take time to have Q&A after his presentation. So please leave the questions in the chat, and we will cover those questions during the Q&A session. And now, without further ado, I'd like to invite Mr. Sergio Cecchini.
Good evening, everybody, and thank you very much, MSF Korea, for inviting me to join this focus session on the emergency response that MSF has deployed for the 2022 unprecedented floods that hit Pakistan. I hope that during this presentation you could have an understanding of the needs that we have to respond to, the humanitarian challenges that we face to deploy our response, and what are the scenarios that we are preparing to respond to in the near future. Pakistan, as was said, has been severely hit by unprecedented floods in the summer of 2022. Before going to a short presentation, I want to give you some inputs about the magnitude of this crisis that the United Nations General Secretary has qualified as climate carnage. The floods that hit Pakistan last year affected more than 33 million people, more than double, almost 2/3 the size of the population of Korea, just to give you an idea about proportion. And 33 million people affected in one country that is considered one of the top 10 countries more exposed to the intensification of climate adverse event. An agricultural country where a lot of the livestock and agricultural production have gone lost during the floods, leaving thousands of people without sufficient means of survival, and also without adequate access to health support and health facilities. More than 1,700 health facilities have been destroyed or heavily damaged by the floods. Why in Pakistan is of particular concern for MSF, and why this emergency response should represent a turning point for the humanitarian community in Pakistan. Because several studies and research show that, as I said, the geographical location of Pakistan make this country highly exposed to the intensification of climate adverse event, in particular monsoon season, intensification of rainy season, heat waves, but also the rise of temperature. The country has amongst the highest mountains in the world, with the biggest glaciers, and the increase of temperature is causing the melting of glaciers. And if we combine this phenomenon with the intensification of heavy floods, we can just imagine the result in terms of vastity of the floods and vastity of the areas hit by these floods. So remember this number of 33 million people heavily touched by these catastrophes. I introduce you a bit of the magnitude of the humanitarian consequence. Now let me share a brief presentation about the context and our response. I promise I won't spend too much time on the medical data not to bother you, but just to allow you to visualize what our intervention resulted in. So if we look at Pakistan, you can see the different spots, green or red spot. These were the areas of intervention, and they are all along the line of main water routes, in particular the Indus River. And you can see the path in the north of the country, mountains and glaciers, and then in the south of the country is where the Indus River reached the sea, and where it makes a series of turns that caused these floods. I'm just back from the affected areas in Dadu, and I can tell you that there are still areas that are underwater months after the floods. Our intervention focused on, let's say, ensuring mobile medical support to the affected communities in the form of mobile, we call mobile camps, malaria camps and medical camps, to quickly assess the situation of the displaced communities, to quickly get their health status, identify the main causes of the main diseases that in this situation are usually skin infection, respiratory tract infections, malaria, and watery diarrhea, to deploy environmental health and water and sanitation activities to ensure access to clean and drinkable water for these communities, and also to conduct vector control activities, to be able to detect as early as we can the possible arrival of epidemic disease like malaria, like cholera, like dengue, or cutaneous leishmaniasis. Also, in the early stage of such a natural catastrophe, we have to imagine that thousands, millions of people have lost everything. They had to leave their houses that were completely flooded with the few belongings that they could have with them. So they were not able to have basic items like buckets, like blankets to protect themselves in the night, and mosquito nets to protect themselves from, let's say, one of the most dangerous vector, which is mosquitoes. And of course, associated with that, health promotion activities to make sure that people could have quickly understood those measures that they've taken to improve their living condition, their hygienic conditions, also how to best protect from all these diseases. Here are some of the districts where we focus in Sindh, but our team responded to the emergencies in Balochistan, in Punjab, and in Khyber Pakhtunkhwa, so in all the basically all the affected provinces today. And this is the reason why you would see location only referring to Sindh, is because Sindh is still facing a new other emergencies caused by the floods. So you can see here some of the activities that we conducted. You see the very mobile team with distribution of water, distribution of what we call non-food item kits with blankets, plastic sheeting, with buckets, hygiene kits with soap materials to ensure adequate protection of the individual hygiene. You can see here briefly the context in which the flood occurred. You can see that it's a very poor setting with houses built with muds, with an already high rates of endemic diseases like malnutrition, malaria, and very poor access to healthcare facilities. Here, a few numbers. We talk about mobile clinics. This is the total number of mobile clinics that we have conducted in Sindh, and the total number of consultations we have conducted so far since the beginning of the intervention, end of August. Here, the main medical needs that we assessed in the situation, as mentioned before, you see malaria, you see skin diseases, upper respiratory tract infection as the main medical problematic that we identified, and usually these are common in all these emergencies. But what is concerning us today is that these catastrophes hitting an already very vulnerable and neglected community that was already living on the minimal limit of economic and social survival, today is causing new emergencies. So if the acute phase of the floods, so of the fields full of water is over, this situation today has triggered two new medical emergencies. Today we are facing malaria outbreak in a season where usually malaria was not circulating in these areas. So we can already see this as an impact, an outbreak caused by these climate change catastrophes. And secondly, and even more concerning, it's the fast deterioration of the nutritional condition of the population in Sindh. We are reporting severe acute malnutrition rate between 10% and 22%. The emergency threshold that qualify a nutritional crisis is 5%. So more than double the rate that qualifies a nutritional emergency. Here data is about malaria. I told you that we're reporting malaria in a season where usually it was not existing, and here some data is about the GAM, MAM, SAM acronym to measure the intensity of the malnutrition rate that we report in children between 6 months and 2 years, and in children between 2 and 5 years. Some malnutrition rate I mentioned you above 10%, but also the other moderate acute malnutrition and general acute malnutrition are above the critical situation. So you could see also here is we were providing medical treatment to children affected by malaria. And other two important components are health promotion. In any natural catastrophe, it's important to support the communities to understand how to prevent vector diseases, how to ensure the best, as much as people can ensure hygiene practice and the best practice to use water and to protect from mosquitoes. And of course, we have to consider that 33 million people eat, means 33 million people for which the life changed from one moment to another, who had lost their previous routine, who had lost their belongings, they may have lost livestock from which the life of their family was depending. So mental health component is still a pillar of our intervention. A few numbers about what has been distributed in this area of Pakistan, in Sindh, more than 23,000 mosquito nets and many different kits, as you can see here. I remain 1 second on these figures because sometimes we underestimate in MSF how we are able to deliver such quickly our emergency response compared to other actors. And it's not a matter of arrogance at all. It's a matter of the peculiarity that that makes MSF a unique humanitarian organization. And this relies on the way we function and the way we are funded. I had the chance to meet many authorities here in Pakistan that were complaining about organization arriving, conducting assessment, looking about the needs, and then delaying their intervention because they were depending from let's say, institutional donors, and institutional donors want to see a project proposal. They have to analyze the project proposal before committing a budget, and before making the budget available to the organization to then come back to the affected areas and start to deploy the operation. The fact that MSF relies on private donation by simple people, my mother, my wife, individuals, these make a huge difference in the emergency response of the organization. Because when our teams arrive, we already have the financial resources to simultaneously conduct assessment and start to deploy our operations. We do not have to wait this long period of time in which a donor has to agree whether our project proposal fits for purpose or whether they want to address our intervention on specific needs. So being able to count on already available financial resource, money, that is the donation of our donors, make a huge difference in the way we deliver our response. And also when we talk with authorities to explain them how we work, the fact that when we arrive in an emergency, we already have a budget to respond to the emergency. So we already have a forecast. So, okay, in September, when I arrived, I already knew that the emergency budget that was allocated for the initial phase of the response until the end of December was 3 million. So towards the authority, I could present myself as head of an organization that I was coming already with financial resources to implement a 3 million USD emergency response, which allowed me to immediately recruit staff, national staff, to immediately start purchase locally and to deploy the response. When they understand the way we function and the way we are able to deploy our intervention, they immediately understand the added value of having MSF. The immediate understand having us around makes that also in perception, the community see that the actors that are able to assess and deliver. And this also for the authorities is an essential component, because this can show all the good collaboration and cooperation between humanitarian organization and local authorities. So you can see here it's a distribution, a water distribution point where we're coming with any means of fortune. Could be a jar, could be a plastic bucket, could be a small blue jerry can to collect water, that safe drinkable water. So these are the number of also rehabilitation that we did. We built deep end pumps, we rehabilitated water pumps, and we are building now our reverse osmosis plant to serve a community of more than 80,000 people in the district of Joy. So I don't want to bother you much more than this. I hope that I gave you also a quantification of what we are doing now. Today, as I said, we are facing new emergencies that have been caused by the 2022 floods, and we are preparing for new scenarios that I'm more than happy to share with you in the rest of the session. Thank you.
Thank you very much for the presentation. I think we got a very good insight into the current situation and the activities that MSF is carrying out. We did get a set of questions beforehand from the participants, and we do also have questions from the audience that we got live. So we would like to present some of those questions to you today. So because of time constraints, please understand that we might not be able to answer all the questions that were asked. So let's go over the questions that we've received before. So Sergio, you did talk about the impact of climate change. And as I know, the seasonal floods in Pakistan is not a new issue. It has been occurring multiple times. But was there a reason that it was more severe last year?
a very good question. The reason is in the climate change phenomenon per se. The rise of global warming is an exponential phenomenon. So no way that, and this is proven by historical data and forecasts. So since decades is not ups and down phenomenon, is just increasing. And global temperature are just increasing. And the effect is just an accelerating effect on phenomenon related to the increase of the temperature. In this particular region of the world, which is seasonally affected by the monsoon phenomenon, the increase of temperature has extreme consequence on the heavy rainfall, and it has been scientifically proved that the intensity of this phenomenon will always increase. What has been let's say unprecedented this year is the vastity of the areas touched by the rain, but also the combination of heavy rainfalls with increased temperature in the higher mountains in the north of Pakistan. So the combination of the melting of the glacier with the heavy rain season. And this resulted also in the different response that we had to adapt in the different location. And for example, in the north of Pakistan, the floods emergency response ended in November, December, while in Sindh, in the south, we are still seeing the consequence of this. Because in the north, we're more related to rains, but especially the melting of the glacier, in the south to heavy rains, and the rivers that were bigger for this phenomenon. This Pakistan is a clear example of what could happen to many other countries, and Pakistan was also a place where major floods occurred in the past. So it's a country that, geographically speaking, is exposed to floods, even 50, 60 years ago.
Thank you very much. We also have questions from the floor. So there are many humanitarian organizations, including MSF. I would like to understand if their level of response by these international community was enough to meet the actual need.
This was one of the major challenges. It's very, let's say, difficult for an international organization to be registered in Pakistan. In 2015, a special law for international organization was approved in Pakistan to frame and provide a very, let's say, articulated legal and administrative framework for international organization to work in the countries, with a series of also monitoring systems and auditing system and parameters to respect. So at the time, many international organizations left the countries because they considered this administrative burden as too heavy for them to survive in Pakistan. MSF decided to, let's say, pay the price to it, so to accept this burden to remain in the countries. But for sure, compared to other situations, the presence of NGOs was reduced, but also the ability for NGOs to mobilize in the emergency response was, I would say, discouraged by these heavy measures. So already we have to see countries where, compared to others, the ability for organization to jump in was very limited. So we didn't see, as we saw, and as person saw in other emergency situation, other organization that you usually see in this situation. So already fewer organizations than in any other context, and then a series of administrative limitations. I can tell you that the time to request a visa is around 6-8 weeks. So by the time that you need to then send a specialist, you have to consider a delay of 8 weeks. Plus, you need to have authorization to move locally. So we managed to work with the local authorities to accelerate in the acute phase of the emergency response these administrative procedures, to reduce waiting times for visa from 8 weeks to 2 weeks, to reduce the waiting time for travel authorization from one province to another province from 4 to 1 week. But these are elements that could have discouraged the presence of other organizations and also the mobilization of the donor community. I give you an example. The UN launched an appeal for 816 million USD to respond to the emergency in early October. In November, they reached no more than 160 million US dollars, showing that unfortunately the mobilization of the donors community was very low for Pakistan.
I think for international organizations, you did speak to the administrative and the logistical challenges that might be a reality. MSF is one of the organizations that are making activities and inroads in Pakistan. And we do think that definitely there would have been realistic challenges that you faced on the ground. We would like to understand more what those challenges were and how you overcame them.
Islamabad, to Dados, where we're deploying our intervention, I need to request a special travel permit that may take between 2 and 3 weeks. So imagine that if you have to send a nutritional specialist or a malaria expert and so on, this could be an important delay to factor when we plan our operations. So in terms of operational management, this is an additional challenge that we have to factor in. And we have other kind of administrative barriers, but I can give you many of these examples. The way we manage to try to cope with them and simplify with them is to sit down as much as we could with the different partners and with different authorities to really make them understand that the rapidity of our response was at the advantage of their communities, and to find together with them in a very transparent way the best way for us to navigate within these administrative and bureaucratic procedures, respecting them, but making sure that we could have moved as fast as we could. So I would say the vast majority of the time we succeeded. Sometimes also we live in a situation that is facing a high level of political instability, a situation where the federal governance system puts some complication. But I think that in Pakistan, we saw how it is important to communicate what MSF is, to make authorities, key stakeholders, but even communities understand who we are and especially how do we work. As I mentioned before, the fact that we are funded by private donors, that we do not depend by European commissions, by any governments, but by individuals, by people which do not have any agenda, which donate money not to change the culture, not to interfere with the way the country is organized, or not requesting any political or social reform, but only to help the people, is something that I didn't expect how surprising it was for the authority to understand how we work. So many times we underestimate how important it is to explain the basic of what MSF is and how do we work.
So it's very important for the MSF to maintain its independence, and the private donors' donation has been playing a very important role in supporting the community. So I would like to ask you the next question. So it doesn't seem like the medical situation or public medical situation in Pakistan is not going to be improved in a short period of time. So in order to help out the medical situation, that you have a mid to long-term plan?
Yes. The context, and especially Sindh, is a context where unfortunately some medical weaknesses were endemic due to poverty, due to also the fact that the population of Sindh is a stigmatized community compared to other provinces, and also let's say the budget for development or for health was underfunded. So yes, there are huge needs. Unfortunately, we cannot respond to all the needs that we see. What we can do now is to work with authorities and to build capacity to try to mitigate some of the most acute needs. And we are planning a series of training with local organization and staff from local authorities in terms of emergency preparedness. Because today, as I mentioned, we're facing malaria and nutritional emergencies, but in 3 months, we will be again at the dawn of a new monsoon season. And the communities that we are assisting today are already fragile and are weakened by the previous monsoons and by these 2 additional medical emergencies.
Thank you so much. So let's move on to the next question. For the damaged areas, I think those are actually a population that did not contribute to climate change. The impact that they're receiving might seem unfair, and it's very frustrating for them. So when you meet with the population there, what are their views on climate change? I think this is quite an interesting question.
Yeah, it's very interesting, but also controversial question when you meet these communities, because the knowledge of climate change, I mean, we are talking about communities that are amongst the most poorest communities I've ever seen in my life, and the different mission that I had with if we talk about poor access to healthcare, access to education is even very poor. The use of child labor, it's massive. So the main priority for them is survival, and their survival belongs to their cattle, belongs to some piece of land that they can have with rice or with other materials. They have knowledge that these events are impacting on their lives, but they are trapped. They have no other option that hoping for the best by remaining where they have their piece of land, remaining where their cattle can eat and can represent a source of survival. Also talking with let's say authorities, they have knowledge, and I've seen people really trying to do their best, but with very, very limited aid. And I was really touched when during the COP27 conference in Sharm el-Sheikh, the president of Pakistan made a very strong appeal for compensation, because it's right. The question is very pertinent. It's a matter of justice between those countries that caused the global warming phenomenon with the high level of industrialization in the past decades, and those countries which had very more smaller rate of industrialization that are paying the highest consequence of this. So it's a matter of justice, and for sure, for Pakistan, as for many other countries, this is felt as between as a discrimination or an injustice, unjust and unfair price that this already fragile community has to pay to the rich and developed countries.
That is right. The climate change is affecting the most vulnerable people. And in order to, so that is why it requires, we need to minimize the impact of the climate change in order to protect our vulnerable people. So we have some questions they received before the briefing. Was there any incidences of flood response collaboration with Pakistan's local healthcare system? And if there was, so can you share some examples?
Yeah. So whatever we do is planned and shared with the local authorities. So as an independent organization, we identify the needs in an independent way. So our agenda is not, let's say, set by authorities, but with our team, we conduct assessment. We develop what is an operational plan. We share with the authorities, and we adjust based on the information that authorities give us. Also knowing that sometimes authorities have their own political agenda. So a director of, let's say, health authorities may belong to a community and may be interested to first serve his community and then the other community. So the fact that we are independent and financially independent means that we can be more assertive in making sure that we go to the most in need first, and that our operational design is based on an independent assessment of the needs. Together with the authorities, we have defined our nutritional and malaria intervention so far, and we have adjusted also the previous emergency response. Sometimes this collaboration can be improved for sure if the trust with what we do can be consolidated. I have to say that I saw that at the beginning of the intervention, September, October, the authorities were more suspicious about MSF. Who you are, how do you work in this part of the country. Today, they know us, they appreciate us, and even the authorization to the memorandum of understanding that we may need to extend or to change, if before was demanding 2-3 months of back and forward. Today, in the time span of a week, we managed to revise this memorandum of understanding. So I would say it's a very good collaboration. Of course, more we remain, more we can be visible, and with the impact that we produce, easier would be to liaise with the local authorities and to plant seeds for future operation in this area.
Yes, I think for the activities that are currently being carried out and for future activities, I think you spoke well to how collaboration is important with the local authorities. I think we also did get another question in advance that we wanted to cover. Because of the devastating flood, we do think that there would have been an impact and damages to the medical infrastructure. In such cases, how do you treat severe injuries?
Yeah, so yes, I mentioned before the number of health facilities that have been hit or severely damaged. What we have seen that, let's say, unfortunately, the most damaged facilities are primary health care facilities. So it's unfortunately because these, let's say, diminished the access to primary health care, but on the other side, secondary and more advanced health facilities are still up and running. I don't say that they're in super good conditions, but we have place where to refer the most severe cases, malnutrition, malaria, or any other cases. So likely enough, these secondary health facilities remain quite active. But it's more the peripheral health system that has been damaged. In remote areas where people have already had in the past some challenges to move, and also sometimes cultural reluctance to refer severe cases to health facilities. In terms of wounded, these floods had likely a very low rate in terms of death, 1,700 people more or less, I mean, which was very good and positive news. And also in terms of wounds, direct wound, not a major impact on the population. We cannot compare the number of the medical needs that you have in these floods to the medical needs that you have in the earthquake that hit Syria and Turkey. So these allow us to focus immediately on, let's say, outreach activities on malaria, all the main pathologies that you have in when huge number of people leave their homes and have to live in the open airs in poor hygienic condition, and to focus on water and sanitation activities. What surprised us is that, and we were very concerned about a possible outbreak of cholera, which likely enough didn't occur. Also because it was not endemic in some of the areas here, but this didn't happen, likely enough.
To ask you the last question. You mentioned about malaria, and you mentioned that the malaria is is spreading throughout the through longer period. And is there any new diseases that did not affect the populations before, but are you seeing new diseases that are happening or spreading among those people these days because of the climate change?
Seeing new diseases, but for example, usually in a thin area, you had 2 malaria seasons. One, let's say October, November, and one in March. This time, there was no, let's say, break in terms of malaria season. From October until now, we still are in a malaria outbreak situation. So let's say that I would say there has been a third and non-usual outbreak of malaria in January and February. So we could see that this, we can clearly say that is a consequence of a very simple reason. The level of water that these floods caused was so high that still today, when you travel in the most affected areas, you see fields with 40, 50 centimeters of water. And these are reservoirs for mosquitoes. So the fact that the water didn't disappear contribute to this third and unexpected malaria outbreak.
Thank you very much for your answer. I think even 6 months into the flood, the risks are still being felt with the outbreak of malaria and the lingering effects as well. We did have a lot of questions today, and we really appreciate the good questions that were asked by the audience. And we also appreciate Sergio for answering the questions as well. So we will now try to wrap up this briefing. So Sergio, if you have any final comments.
I want really to thank MSF Korea for having, let's say, switched on a spotlight on Pakistan, because I mean, it's my third time in Pakistan. The previous time was during the 2005 earthquake, and unfortunately, Pakistan is not is a quite neglected country. It is not a country that suscited the sympathy of people and audiences for many reasons. It's associated to armed groups, terrorism, and so on. So sometimes you feel that what happened in Pakistan is considered less important, less relevant to what happened in other countries. And the fact that you decided to focus this session on Pakistan, for me, it's a very good message from MSF. To MSF supporters, but also something that when I said here to my team here that I was busy because there was a MSF section that wanted to understand what were the challenges here in Pakistan, I can tell you that the emotion of my Pakistani colleague were of proudness to see that MSF didn't forget about Pakistan. And then today, months after the floods, MSF, in particular MSF Korea, decided to have a focus on this and to mobilize and engage with the donors, with friends, with supporters, with whoever was interested, to make them aware about what's going on. I mean, really made my day, and I think that is the best way to express my gratitude is to say thank you, MSF Korea. Thank you, everybody who put on the agenda this event, or instead of going to the gym or instead of doing other things, you wanted to listen what we are doing here, the challenge that we face, and what we are preparing for the near future. So thank you very much. I wish you all the best and the best of luck from Pakistan.
Okay, thank you very much, Sergio, for your comments. And we understand that you're also very busy with your activities in the field, so we really appreciate your time. As you mentioned, in Pakistan, there are a lot of difficult circumstances they are continuously facing. So I think amid such circumstances, continued support and interest is very important. We will definitely keep supporting and have interest in the activities that are being carried out. MSF is definitely trying to work and help people of all races, religions, and political beliefs who are suffering in conflicts, epidemics, and medical exclusion. There was also the earthquake that occurred in Turkey and Syria last month, and they are very much unpredictable, and they occur in a short period of time. And as we saw in the case of the floods in Pakistan, they have continuous lingering effects. So the response equally will take as long. I would like to express my sincere appreciation once again to all those who supported MSF's beliefs and activities, and to all that took an interest in the humanitarian crisis. It is because of your continued interest and support that MSF can carry out our activities. If you have any questions about the MSF, about our activities, our operations, or recruitment, if you want to find out more, please visit our website, msf.org.kr. And we also have an official social media channel to share with you our international activities and share the news in a regular period. We ask for your continued support for the MSF moving forward. So we will see you in our next focus briefing. Thank you all. Thank you very much for participating.